global level. Today, we're very excited to welcome Congressman Buddy Carter to talk to us about a number of things happening up on the Hill. And I'd like to thank Cornerstone Government Affairs and Joseph Santoro on my team for pulling this together. Next week, we will have another policy webinar like this, another town hall where we will welcome BIA, the Biotechnology Innovation Organization, and pharma leaders to come and talk to us some more about where we're at. As many of us know, this issue and this crisis we're in is changing on a day-to-day basis. So what we talk about this week may be very different, and if we're talking similar subjects next week. Georgia Bio for the last month really, have really been trying to be there on a one-off basis for our members individually and our member organizations to support them during this response and during the challenging times many of them are facing. We are working closely with our state legislators in the governor's office and some on the COVID-19 task force on supporting response needs and getting PPE around and just coordinating and supporting those that really need help, especially our frontline workers. We continue to work closely with Bio and AdvaMed as well on a federal basis and a national basis to really mobilize our industry in order to make things happen and get things to those that need it most right now. We're going to be joined by Congressman Buddy Carter. He is an experienced businessman and healthcare professional and a faithful public servant. As the owner of Carter's Pharmacy, Inc., and Southern Georgians have trusted Buddy with their most valuable assets, their health, lives, and families for more than 30 years. Congressman Carter is serving his third term in the U.S. House of Representatives and is a member of the Committee on Energy and Commerce. As the only pharmacist serving in Congress, Buddy is co-chair of the Community Pharmacy Caucus and is dedicated to working towards a healthcare system that provides more choices, less costs, and better services. As a representative of District 1, I think those of us down in Savannah know where that is, Buddy represents an entire coast of Georgia and also serves as a member of the Select Committee on Climate Change. So we would like to thank Representative Carter and his team for joining us today and providing an update to our members and answering their questions. My name is Maria, by the way, we've never met. I'm Maria Thacker, I'm president over at Georgia Bio. So thank you again for taking the time. Sure. I have already read your bio and, and giving the background. So if you're ready, we're happy to hand it off to you. You give us your remarks and then Joseph will handle some Q&A. Okay. All right. Well, thank you again, Congressman. The floor is yours.
Thank you. And again, my apologies for being late. We're in Wayne County, which is kind of the western part of our district, and we had some tornadoes here night before last, and I tell you, the devastation is just unbelievable. It's I don't know how many of you have ever seen an area that's been impacted by a tornado, but it's just like it hops and skips. There are houses that are totally devastated, totally destroyed, and then the next house over looks as if nothing has even happened. So it's just amazing. But fortunately, the whole community is pulling together and everybody is helping out, and I think they're going to be fine. We didn't have any fatalities. We did have a couple of people, 3 people who were hospitalized and destroyed about 30 homes, but nevertheless, we're just thankful that we didn't have any loss of life. Let me begin by talking about the COVID-19 coronavirus. I use them synonymously because they are essentially the same thing, as you all know. In Congress so far, what we've done, we've had the opportunity to pass 3 pieces of legislation. Very quickly, I'd like to go over those. First of all, we passed the first phase, which had to do with making sure we had tests for everyone, making sure that we were developing the test. Also making sure that there was money going to the NIH, the National Institutes of Health, as well as the CDC, to do research and development on vaccinations. That was very important. Then we passed the second phase. The second phase had to do with making sure that those tests were going to be available to everyone and that you wouldn't have to pay for them. That was very important. Also in the second phase, we made sure that we had sick leave and family leave in there, and that companies that were offering the family leave and the sick leave would actually be able to get a tax credit in order to pay for that. So that was part of it as well. And then, of course, we passed the big package, the third package, called the CARES Act, the Coronavirus Aid, Relief, and Economic Stability Act. That stands for CARES, and that's where we got the acronym from. And that was the third phase. So when I say the CARES Act, I mean the third phase. It was $2.2 trillion, the first time that I've ever voted for a bill that had a T behind the dollar. In fact, I think the president said that was the first time he had ever signed a bill that had a T behind the dollar mark. But listen, we need this. This is something that we've never been through before. This is something that none of us have ever experienced. There is no playbook for it. There's no best practices for it, or at least there was not when we started. Fortunately, we've learned a lot of things. We've done a lot of good things. We did some things that perhaps we would do differently next time, but we have done a lot of good things. So in the CARES Act, the $2.2 trillion Act and $2.2 trillion legislation, we actually had a number of parts of that, not the least of which was the individual stimulus. The individual stimulus, of course, will mean that each taxpayer, each person in the country will get $1,200. That will go to the head of household, and there'll be $1,200 for the spouse and $500 per dependent if you make less than $75,000 a year. Now, if you make between $75,000 and $99,000 a year, it'll be tiered. You won't get $1,200. You will get something. It won't be $1,200, but it will be tiered. If you make over $99,000 a year, you won't get a check. Now, the good news is that as we were just surveying the damage from the hurricane, I was talking to some of the people that I was with at that time. They had already gotten their check. They got them in the direct deposit yesterday and today, and they're very happy that they've gotten those checks. That's very important because we made it perfectly clear to the administration, and the administration agreed, and they wanted it anyway, that we needed to get that money out as soon as possible. Now, let me touch on that for just a second, because the CARES Act, the third phase of the relief package, was really, we really passed that very loosely, if you will. We did not put a lot of rules and regulations in there for the agencies to follow. We made it clear to them that we did not want fraud, waste, and abuse, and we wanted them to be efficient. However, we also made it clear to them that we wanted them to get that money out ASAP. We wanted to get it out as soon as possible, and because of that, we weren't going to put a lot of rules and regulations in it. That's what we did for the individuals. Now, for the small businesses, which, as you all know, is a big part of our economy. Small businesses make up for about 90% of all the businesses here in America and employ about 50% of all the employees. So they are very, very important to our economy. For the small businesses, we actually created a program that did not exist. Now, that's hard to believe that there's a program in place right now and functioning that a month ago did not even exist. Kudos to the administration and kudos to the agencies for being able to do this. This program that we started was called the Payroll Protection Program. That is a program by which small businesses, defined as those with 500 employees or less, are able to borrow in a loan up to 2.5 times the average monthly payroll, or $10 million, whichever is least. So they can actually borrow up to 2.5 times the average monthly payroll, or $10 million, whichever is least. Now, the intention there of Congress in creating that program, or having the administration create that program, was to retain the employee-employer relationship. We wanted to make sure that people were able to stay employed and stay off of our unemployment ranks. That was very important. And certainly we wanted to make sure that small businesses were able to retain their employees. I was a small businessman for over 30 years, and I know how important those employees are. I know that they make the business. So that was very important to us. The good thing about the PPP, the Payroll Protection Program, is that, yes, it is a loan, but it can actually be forgiven if you use it for the right things. For instance, if you use 75% of your loan for payroll, you can have that 75% forgiven. That's very important. Also, you can use it for rent, mortgage, and other things. And that's why it's very important that we have that program in place. Now, I will tell you, I was on a conference call with the Republican members at 11 o'clock this morning, and we had Secretary Mnuchin as our guest. And he answered a lot of questions about this program. He acknowledges, and I do too, all of us know that there have been some bumps in the road. There have been some bottlenecks. But I will tell you, the administration and the agency has done an outstanding job of getting those things fixed and cleared up as quickly as they possibly can. In fact, we had a number of questions on the call today that the secretary said that he would go right back and work on FAQs, frequently asked questions, to put on the website concerning those questions that we had today. And in many cases, it means that he's got to decide on the policy, and the administration's got to decide on a policy in order to address these questions. So very impressive what they've done thus far. In fact, the secretary told us that the program has been in place for 7 days. It started Friday, was a week ago. So it was up that Friday, that's 1 day, and it was up all last week, that's 5 more days, so that's 6 days, and it was up yesterday for 7 days. Starting day 8, over $240 billion of the 350 that we allocated, that we appropriated, has already been awarded. Over 1 million applications have already been approved. That's pretty phenomenal for a program that didn't even exist 30 days ago. So that's very important to keep in mind. Not only did we create the PPP, but we also increased funding for some small business administration loans, such as for the 504, such as for the 7A, such as for the EIDL, the Economic Injury Disaster Fund. I'm sorry, disaster loan. Economic Injury Disaster Loan. That's very important. The EIDL is a good program. The secretary told us today also that that program is going to have to be shored up as well. It's become so popular, and we've had so many small businesses apply for loans through that program that we have got to shore it up as well. So we've got to get some more money to those programs. So I told you the PPP was originally appropriated for $350 billion. The administration came back and told us we need $250 billion more. What happened was that the Senate last Friday tried to take that up and do it by unanimous consent. Unfortunately, they were unable to get that done. Therefore, now it is still hanging out there. As I said, $240 billion of the $350 billion that we appropriated through the third phase has already been spent and already been sent out the door. So we've only got about $110 billion left before we'll start having to have more funding for that program. And I'm confident we're going to be able to strike a deal to get that done. What it will look like and what else it will include is difficult to say, but I do feel like it will be taken care of. So that's the third phase, essentially. Now, I get asked quite often, is there going to be a fourth phase? I suspect there will be a fourth phase. My hope is that we will let the third phase develop and let it get out there and see how it does before we do a fourth phase. I think that there's going to be a need for a fourth phase. Now, if we can get the $350 billion added to the CARES Act, I don't consider that to be the fourth phase. They wanted to do just that. Now, the other side wanted to put some other things in it, but the Republican leadership wanted to do just the $350 billion, or excuse me, the $250 billion more for PPP. And I hope we can get that done in what would be 3.1, say, something like that, but not 4. Now, how do I feel about stimulus package 4? First of all, I'm in favor of us doing whatever we've got to do to protect the health of our citizens. If there's more money needed for a certain program that's going to help our citizens and help their health, then I want that to be done. There has been some chatter about how can we help our economy through this? How can we help our economy through phase 4? We are hoping that our economy will be a V-shaped rebound. In other words, it went down quickly. We hope that it'll go back up quickly. One of the ways that possibly we could help that is to have an economic stimulus, perhaps dealing with infrastructure. And that's what we hear talked about most of all, is having having it to where we could include in phase 4 infrastructure. Now, keep in mind, infrastructure is bipartisan. Everybody needs infrastructure, whether it be a bridge, a road, the seaports, or rural broadband. I think the definition of infrastructure varies according to who you talk to. So when I say infrastructure, I'm certainly hoping, and I recognize we need more bridges and roads, but I'm certainly hoping that we're talking about, that we're also talking about rural broadband and some other things that may not be mentioned all the time whenever you're talking about infrastructure. I'm not going to say that I would vote for that bill. I will say that I will consider it. If it is a way that we can have our economy rebound, then it's certainly something we need to look at. So I want to see it. I would like to see us wait first and see how phase 3 works. See how it gets out there and how it does. Then we could possibly look at a phase 4, but we'll have to see what happens. I want to tell you very quickly about 2 bills that I'm sponsoring. One has to do with scams and price gouging. I'm actually the lead Republican sponsor in a bipartisan bill that is called the Pandemic Scams Act. And we've all known there's bad actors out there, no matter where you're at. And we know that there are people who are advertising on the internet for tests that are not accurate. We know that there are people who are advertising on the internet for PPE equipment that's inadequate, personal protection equipment. That's certainly something we can't tolerate. And now we find ourselves trying to make sure that those scams get out there and they are communicated and disseminated among the public. So what this bill would do will be to require the FTC, the Federal Trade Commission, and the HHS, Health and Human Services, to come up with a website, first of all, to disseminate that information any way they can, whether it be through public TV or whatever, public service announcements. But also, we've asked them to make sure that they start a website. And a website, on that website, what they'd be able to do is to list all the different scams that have been called into the office and make it user-friendly so that people who might have experienced a scam would be able to enter it into it as well, so everyone else can see what people are trying to pull over their eyes. And keep in mind, as I said, scams, same thing as price gouging. If you have an experience with price gouging, I want to encourage you, please contact our office and let us know about it. 912-352-0101. Very important. The last thing that I want to mention, and I'll stop talking and we'll try to answer some questions, but the last thing I want to mention is another bill that I'm working on, and this has to do with pharmaceutical manufacturers. Right now, pharmaceutical manufacturers, we are seeing a lot of them that have gone overseas, and as a result of that, right now, we have China controlling 90% of all the antibiotics that we get are coming from China. Same thing with ibuprofen, same thing with some vitamins. Almost 90% that we use in America is coming from China. We need pharmaceutical independence. We recognize that now. Now, if we don't address this and do something about it after what we've just gone through or what we are going through now, then shame on us. Because just like in the late 70s, when we discovered that we were too dependent on foreign oil from the Mideast, we recognize now that we're too dependent on pharmaceuticals. We recognized then that we needed energy independence, and we got it. That's what we've got to do next for our country, is have pharmaceutical independence as well. Well, I'm sure there's much more, but I'll kind of stop right now to answer any questions you might have.
Thank you, Congressman Buddy Carter. This is Joseph Santoro, Head of External Affairs at Georgia Bio. I just want to thank you again for your time today and willingness to answer our members' questions today. And thank you, everyone, for joining us. As Maria mentioned at the beginning of the webinar, we do have a Q&A button at the bottom of the Zoom where you can type in any questions, and we'll try to get to as many as we can today. But just kind of going with some of the ones that we've got pre-submitted. Thank you for giving us a brief overview of the 3 supplemental packages that have been passed: the Coronavirus Preparedness and Response Supplemental Appropriations Act, the Families First Corona Response Act, and the CARES Act. Just a few questions regarding some of those legislations that have been passed. So how does the Family First Coronavirus Response Act expand access to healthcare diagnostic testing for COVID-19? Does this law apply to federal healthcare programs? And will the uninsured have access to testing as well?
Yes, the uninsured will have the uninsured will have access to testing. We made sure of that. That was in phase 2. We made sure that everybody, regardless of whether they had insurance or not, that they would not have to pay anything. And that was a very important part of what we did. It's also important for us to make sure that we understand that, we put money in there, as I mentioned earlier, to go toward developing the vaccination. Vaccines take time. And I think that when I hear the administration talk about possibly having the vaccine to this developed by the fall of this year, is simply phenomenal. I mean, usually you're talking 3 to 5 years before you get a new vaccine out there. And to think that they could do it in almost less than a day, less than a year, is really phenomenal. And we should be applauding them for that. So we have to continue to push for that and continue to make sure that that they're doing everything they can, both in the private sector and in the public sector, to come up with vaccination for this.
Thank you for your response. So you kind of touched a little bit on what's coming next with the Supplemental 3.5, the Interim Emergency Coronavirus Relief, and the Supplemental 4 CARES Act 2.0. Are there any additional insights that you can provide, things that businesses and other individuals need to be concerned about or plan for?
Through this process, we have discovered a number of what I refer to as nuances, things that we just didn't anticipate, things that nobody really could have anticipated. Examples are where we're struggling a little bit with people who get 1099s and referred to as 1099ers, that's the way they get paid. And I know that we really didn't plan on that. So we will probably see a lot of those nuances addressed in the supplemental package, in the next package. Things that, as I say, we just didn't see coming, we didn't realize might be a problem. Some of those things will be included in there as well. Let me say this, anything that we need in the way of more money to protect the health of our citizens, I think we'll have that. So if we need to have more money come toward certain programs that will benefit the health of our citizens, then we'll have that.
Great, thank you. And just, I think a lot of us, both here at Georgia Bio, the state and others, have been creating resource pages, trying to keep their members and their constituents and others informed about COVID-19 activities, testing locations, et cetera. What are some of the best practices that you've seen and utilized, and how are you keeping your citizens informed at this time?
Well, we've been doing a lot of these conference calls. I've learned a lot. I didn't even know what Zoom was or GoToMeeting, and man, there's a bunch of them out there now. And certainly we've been able to keep our constituents informed that way. We've had a number of teletown halls that are very good and well attended. We've had some special guests on them with expertise, like I had Steve Shabbat, who is a ranking member of Small Businesses Committee, and Steve was a great resource last night. We've had Andy Barr with Financial Services Committee on with us, again, to talk to some of the bankers and some of the credit unions in our district to make sure, and he's an expert in that area, so it was good to have him with us to answer more detailed questions for them as well. But we just continue Facebook Live and that type of thing, live streaming that, and making sure that we're disseminating the information as best as we can. We got our newsletter, buddycarter.house.gov, which is very accurate and certainly very important as well.
Thank you. And this kind of in line with a question that we just received today. It would be interesting to hear from you what it's like to work and legislate remotely.
It's different. I will tell you that. It's certainly a new world, as I mentioned earlier. I didn't even know what Zoom was before I started doing this, but I suspect we're going to see a trend now with this type of thing. There'll be more people working from home and more people utilizing these platforms that we've been utilizing as well. I know that I know a number of companies are doing it now, and I suspect there'll be even more doing it in the future.
So I think we've all now have gotten accustomed to using Zoom and other platforms to work remotely, and it's been a transition, but I think we're all adjusting very well. So next question, and I know a lot of our organizations within our membership in the life sciences area have been creating and putting together a lot of unique public, private, and even government partnerships. So I wanted to get your perspective and see what type of partnerships that you've seen to help combat the coronavirus crisis.
Well, certainly with the National Defense Act that the president had activated, he's been able to essentially make sure that the ventilators getting made by GM and Ford, and that's very important, and we certainly have seen that. We've also seen a lot of companies step up, and that's what's so encouraging, because companies who are in the apparel business step up and start making face masks and helping with PPE. PPE has been a problem for quite some time now, and making sure that we have all the supplies that they need is extremely important.
Absolutely, thank you. So just a few more questions that we have from some of our members that pre-submitted. What is the federal government, so HHS and BARDA, doing in the distribution process, such as decision-making, timelines, et cetera, of the billions of support of R&D for vaccines, therapeutics, and diagnostics?
Well, that's certainly important. And I'm sorry, you broke up just a little bit there. Can you repeat that?
Yeah, essentially it's what is the federal government distribution process of the billions of support for R&D for vaccines, therapeutics, and diagnostics?
Yeah, okay. Certainly we want to make sure, and we need R&D and we need vaccination for this. As I said earlier, as vaccinations go, what they're trying to do is simply amazing. I mean, generally when you talk about developing a vaccination, you're talking about 3 to 5 year process. Already we're thinking that it's possible we could be getting some vaccinations in the fall in mass production. That's phenomenal when you think about it. And, the president and the administration has made certain that what they're trying to do have been through the private and public relationship and partnership. I think they should be applauded for that because it's worked well. The president has taken, the task force has taken the all of government approach and utilizing everything that they can. All that is so extremely important. I think that we've learned a lot through this. And I think that, even though at the beginning, as I said, there's no playbook, there's no best practices for this. Well, at least when we started, there wasn't. I think we've learned a lot and learned some things that we need to address. No question about it. One of the things that, if I could mention this, is pharmaceutical independence, making sure that we have the ability to get those medications and that are currently being made in China. And that's certainly something that's important as well.
Absolutely, thank you. This is a little bit of a longer question, so I'll try to talk a little slowly. Given the unprecedented nature of COVID-19 on the lives of Americans and people across the world, the ability to adequately and fully prepare for a pandemic of this magnitude was extremely difficult. One area where response has been concerning is respect to essential service providers. This member runs a credit union, and as a financial institution, they are considered an essential service and are expected to serve the public during these times of emergency. While it is their duty to carry on, his or her question is, what role do you view the government has to better protect essential service providers during times of hazard? This goes for food service, groceries, delivery of those services, healthcare, financial, first responders, et cetera.
That's a great question. And it's a great point to make because, right now our heroes are wearing white lab coats. I mean, our heroes are our medical personnel who are essentially putting their own health at risk in order to provide for other people. we have been so dependent on truckers, so dependent to keep our shelves stocked, so dependent on grocery stores to make sure our essentials are there. So yeah, we recognize this, and those are just a few examples of many of the essential services that have continued throughout this. And we certainly feel like they should be recognized and also rewarded for that. And certainly that's something that we're going to look at. And I don't want to make any promises, but if there is a phase 4, perhaps something like that will be included.
Great, thank you. And here's another question. Thank you for being the sole Georgia rep to sponsor the immediate relief for Rural Facilities and Providers Act with $0 of the $100 billion for hospitals designed for rural. What can be done to make sure the rural crisis is not forgotten amongst the urban focus? And almost half of all rural hospitals are at risk of closure during this crisis.
You know, I'm a member of the Doctors Caucus as a pharmacist, and currently the only pharmacist serving in Congress. I'm a member of the Doctors Caucus. We've had at least 2 or 3 conference calls every week. And I will tell you, the rural hospital situation has been one of the top topics that we've been discussing on that. That's something we got to pay close attention to. We were very fortunate, and I have been remiss not to mention another important part of phase 2 and phase 3, and that is telemedicine and telehealth. We actually put funding in there in phase 3 for telehealth. That's important, particularly during this type of pandemic, because you don't want people going to the hospitals. You don't want people going to the doctor's office in crowded places. You want them, if they can be treated at home or through telehealth, that's the way you want to treat them. So we were successful with that. Now, we've been pushing telehealth for some time now, and we've been saying that we need to do more in the way of telehealth. Well, this experience has accelerated that. Now telehealth, I think, is going to get the attention that it deserves, and it's going to be reformed even more quickly than it would have before. Another thing that we've discovered, particularly in the rural areas, is the need for rural broadband and rural high-speed internet. That is very important. And certainly we had money in phase 3 in the CARES Act. We had $100 million in there to address this situation with some of our rural areas that didn't have internet access. And that's actually good. And I've seen a number of communities do some very innovative things, like having a hotspot. Maybe the library is the hotspot in the community, and people go in there in order to log on, in order to do what they need to do electronically. So there's definitely been a lot of things that we've learned that we need during this process.
Great. And this is kind of on the similar lines of, I think, your pharmaceutical independence legislation. But we've seen very surprising shortages of key drugs and PPE for hospitals treating COVID patients. In fact, I know you and Nick in your office have assisted in trying to remedy some of these drug shortages. So what should we do in the future to avoid being in this type of place where when the next crisis hits?
Well, as I mentioned, the pharmaceutical independence, that is extremely important, making sure that we're not depending on any one country for all of our pharmaceutical needs, like is the case for antibiotics, 90% coming from China. Not only that, but did you know that India makes 18% of all the generic drugs in the world? And they are dependent on China for the active pharmaceutical ingredients that go into those generics. So again, China's playing a leading role here, and we've got to make sure that we take back that leading role. And we will. This is good legislation that we have to incentivize and encourage companies to move back to America. And somebody made a good point on another call, is that, we don't want them all in America either. We need to have a good supply chain to where if something happens in one plant, we can go somewhere else and still access whatever it is we're trying to get there, whether it be pharmaceuticals or whether it be PPE or whatever.
Great, thank you. So another question here from one of our members. They say, thank you so much for your efforts and energy for the citizens of Georgia. This member has a friend who owns a small restaurant. They processed their small business loan and are waiting for a response. When will they know how to proceed after April 30th? At this point, I think a lot of other businesses are, figuring out logistics, food, things, and other things they need to be doing.
That's a great question. What's the rollout going to look like? Look, I think the next 7 to 10 days are critical. I think the next 7 to 10 days will let us know exactly what we can expect in the way of a rollout. We've got to be very careful. The president has said, rightfully so, that this was the biggest decision he's ever had to make, and it is a big decision. I know that there's been talk about some of the governors doing it on their own. Well, keep in mind that if we try to bounce back too quickly and we have a relapse of this virus, then everything that we've done is just out the window. That's why it's got to be gradual. That's why we've got to have it uniform. Everybody's doing the same thing and understanding what our intent is. I think as long as we do that, we should be able to get back up and running pretty quickly.
Great, thank you. Another question, what are some of your ideas regarding relocating offshore API manufacturing back to the US? Thank you. And they said, thank you for all your efforts as well.
Well, I don't want to mandate it. Somebody asked me that on an interview, you're going to mandate that happen. Obviously I don't. I'd rather incentivize and encourage. And we, at one time, some years ago, we had a lot of pharmaceuticals that were being manufactured over in the territories, particularly in Puerto Rico. Unfortunately, there was, I'm not going to say abuse of that, but it was not being done like it was supposed to be done. So I believe it was under Clinton that we ended that. But we need to think about how we can incentivize and encourage those companies to come back. It's not a matter of just America first, although I agree with that. It is a matter, though, of making sure that we have pharmaceutical independence, and therefore it's important to our national security.
Absolutely, completely agree on you on that. So next question, with the COVID-19 pandemic, where do you think this puts the chances of a 340B reform over the next several months?
Well, that's a good question. Keep in mind that, I'm in favor of more transparency, and that's what I've wanted all along. Dr. Bouchon and I have made it clear, we're not trying to end this program. And I think it's unfair when we get criticized saying, why do you want to do away with this program? We've never said that. All we've simply said is we want transparency in this program. We want accountability. And I don't think not only do I not think that's something that we should be ashamed of asking for, I think it's something we should demand. We should have that in that program. Let's face it, I think it's moved a little bit to the back burner now with everything else that's been going on. So I suspect that we're not going to see a whole lot on it, at least not this session.
Great, thank you. And I'll kind of end it with this question. How can Georgia Bio, our organization, and all of our members support you and your efforts in this time?
Well, I appreciate that very much. Our primary was moved back in Georgia. It was originally scheduled for May 19th. It got moved back to June 9th. We have 2 opponents in the primary, and then we've got 3 people running in the Democratic primary to run against us in the general. We appreciate everyone's support, and I certainly am very appreciative of that, to your support. Only 2 ways to run, unopposed and scared, so we're running scared. We should be fine, but as I say, we're going to run scared. We're going to do everything we're supposed to do, and we're going to run hard, and we're going to win.
Absolutely. Well, thank you again, Representative Carter, for joining us today, being a champion of our industry, and being willing to answer some questions from our membership today. Looking forward to continuing working with you in the future, and feel free to lean on us as a resource, and happy to work with you and our members the best we can.
Great. Thank y'all very much. And again, my apologies for my tardiness earlier, but I hope you understand. Thank you very much.
All right. Yep. Thank you. And thank you everybody for joining us. Have a great rest of your day.